So, and it makes me look skinny, so that's another reason I like it. All right, so the TNA and DNC final should have opened up. If it hasn't, let me know so I can make sure it's opened up for you. We're not going to go through the sheet because you just have to read it. The only thing that changes is once you get down to counts. There's no counts in TNAs and DNCs. Woohoo! But everything else you still kind of need to do. These are surgically clean cases, but that does not mean that you should not continue with your aseptic technique. The other thing that I want you guys to see is how these packs are wrapped. We kind of let it slide on the breast biopsy. We will not let this slide moving forward. Why? Because you're setting each other up for failure.
No, what's my favorite?
So when people fold these back, people just throw them together. They're not taking pride in their job. You may start off in SPD. Well, guess what? In SPD, you're going to be the one dealing with these instruments. So if you're not taking pride in it here, how do we know you're going to take pride in it? I'm sorry. How do you know I'm going to take pride in it when you get there? You also know for the TNA, the bed. The foot is usually at the head, vice versa. And if you notice, this is the foot. Should be the foot. Why? Because in a TNA, the surgeon is right here, and we're sitting normally. All right, some of them stand. The items that you need for a TNA to pop up. I'll make sure I get it on the camera as well. You need a Yankar. Disposable. You need tonsil balls. They come in packs of 5. So now you're going to be writing tonsil balls in on your sheet. Tonsil balls. Light handles, if it doesn't come in the pack. A suction bogey. It is different from a regular bogey. You need a suction bogey. Okay? Trying to make sure I get on the camera too so you guys can come back. And a red robin. You'll notice that behind you, there are a lot of them. Okay? You need a red robin.
This is for TNA, right?
We're in the TNA. We're doing the TNA. Okay? Look where I'm putting my pill packs. The patient's not here. A lot of you guys, I noticed, were running back and forth during your test because you'll have them on your case chart. Get everything closer to you. A lot of times you'll see a lot of techs who put our sutures in our pockets. That way it's boom, boom, boom. Okay? Because time is money. It's not supposed to be, but you guys get what I'm saying. Surgeons still want to get in. These are made. These are TNA packs. You notice it's just one pack. Okay? See how this is wrapped. This is what we expect. That way, if Joshua's coming and Priscilla just finished this, Joshua should not have to fear that Priscilla set him up. Maybe she does, maybe doesn't, I don't know. But you want to present it as if you were going to open this. You're still pulling it out of the pack, you're still checking it, making sure that there's no tears, no rips, right? I've already cleaned my room. I've already checked my surgeon's preference card. I already know exactly what we are getting ready to do. I've dusted, I've done my 3-minute hand wash. You guys see what I'm doing? I've checked all my equipment. I know that I'm using a suction bogey. So since I know I'm using a suction bogey, not only have I checked and pulled my equipment where it needs to be, I've turned it on. This actually turned on. I've actually turned it on and turned it off. I've checked my suction. Start grabbing it. We will have these put together for you guys. But grab your suction. Get your suction together. Same thing. See where it goes? Turn it on. Plug it in. It works. Okay? Make sure that everything works.
The Bobby suction?
Turn on your suction. You have a suction now, you have a Bovie. Suction Bovie. Arrange your equipment. Now there's some things I'm omitting because you guys have already done it. You already know how to do it, right? I have arranged my equipment where I need it to be. You will notice I'm not using this. Check to see how you open this. And granted, I know we're saving all these things, so it's all about attention to detail. So when I first open this, I know that it's gonna go like this. See where my hands are? Notice how I'm walking. A lot of you guys will walk as if you're going to the mall. You're just chilling, hanging out. It's all about attention to detail. In this pack, you have 8 towels, 2 drapes, a mayo stand, suction tubing. You have a specimen container, Raytex, marking pen. So then the other things you need to actually pop up, right? So you're going to check the integrity of all your items. Go ahead and pop it up. Checking the integrity. Remember, these are all manufactured. So of course, when you guys reopen this, it's going to be a little bit different because you're going to have to peel pack it. One thing you notice that I'm doing is I'm kind of standing here. Why? I have more room to pop up. So for the brush wrap, he was letting you guys get your feel, what works best for you. Okay? And breathe. Other thing, you notice I'm folding this here? So that when I do open this, you're probably like, why didn't she show us this before? Because first time you guys got to figure out what works best for you. You guys see? It's cradling in a little cup. And then, you guys saw that? This one is probably going to be the beast for a lot of people. All right? This is one of those you just get on the field. So, I wouldn't use this. Why? What happened, Josh? It went all over. So this is probably one where I would probably let my circulator give to me, to be honest with you. But just make sure that you get this on your peel. The last thing you gotta do is grab your, see, even if I'm not, how's my body movement? I'm still looking at my field. I get it down. Last thing you would pop up is what? I forgot to get my gown.
What size?
Whatever. And then, may I use you as my surgeon? Yes.
You'd still be popping the surgeon's gloves and your own gloves.
They're grabbing it for me now. They're grabbing it for me now. What size glove are you? Oh, they're only, I only got grab it. So, perfect question. So yeah, this goes on before I put on my mayo stand. Thank you. So before I open up my gown and glove, I still gotta open up my surgeon's. This is a part of your popping. You okay, Josh? Unfortunately, that is on camera.
Oh
Well, we'll just call it Pedro.
Okay.
Pedro, you okay?
no.
Oh, it's roulette. All right. So I would have popped up my surgeon's gown, but surgeon's gowns go in the pack. Did I get that? That's the only thing I didn't put in here. Surgeon's gown goes in the pack. Last thing I'm going to open up is my gown and glove. Now keep in mind, depending on your facility, you will notice that some places, unfortunately, don't even put on a gown and glove for a TNA. So that's per facility. But we want to show you as if they do. Okay? All right. I've already done my first scrub of the day, so then I would do what? What did I forget? Remember, sometimes we do stuff to see if you, what we forgot. Yes?
Doctor circulator. No, sorry. I don't.
That's okay. Do I have something to perform surgery with? Bam! I forgot to open up my instruments. So these are things we want you to try to catch us with, okay? TNA, tonsil adenoid. Normally this would go on a prep stand, but I have my camera there, so just remember when you open up your instruments on a prep stand. Yes. Thank you. And then I'm going to add guard. Okay? I allow it to dry. Manufacture. Then I am going to grab, pinch. Not even worried about that. Oh, I should have grabbed somebody who was here. Priscilla, can you be my circulator? My bad. Just tie me up. Just tie me up. I have moved far. Oh my gosh. Gosh.
What'd you do?
That's what I did. I know. I have moved away from my mail stand. No one can ever question my technique when you're that far away, right? A lot of times individuals get caught up on the gowning and gloving part, and that's what's been slowing you down. Once you get past the gowning and clothing part, it shouldn't take you that long. Can you grab my stuff for me? Now, for the TNA, you've always noticed we always say move with a purpose. Make every movement count. In the TNA, I'm going to go a little slow so you guys can see what's in it, like I mentioned. You have your 8 towels, or probably a little bit more. You have 2 sheets. I want you guys to make a note of how these look, because you guys are folding them wrong and setting each other up unknowingly, and it's okay. But work on, when you guys hold this back, you should be able to see the words. Okay, make sure I put that on camera so you guys can actually see the words, okay? So it should look like a book. You have your mayo stand cover. And these are the items that should be in here. Suction, asepto, syringe, Braytex, specimen container, and labels. Now, I've always told you to set up opposite of anesthesia. And some people will be like, well, the head's here. Yes, but in the TNA, anesthesia will probably be over on this area because we turn the back. So it's still opposite. The thing is, you're going to be right here, and then your back table, I don't even use a back table, to be honest with you, but we're going to make it work. Same here, mayo stand. Grab your mayo stand. This is extremely important because the retractor is going on that mail stand. You're going to have to get comfortable with not really being on your mail stand like that. I'm that tech that leans on it. So for TNAs, I have to be extremely careful so that the patient doesn't go into a laryngeal spasm. Okay? Next, get your drapes ready. You're still going to have your down drape, right? Then we do what's called a turban. You're going to take your half sheet, and I do it a little bit earlier. I just don't spread everything out. Grab 2 towels. And I will show you, once my surgeon comes in, how you really do it. Okay? That's out of the way. I like to move with a purpose, so I know that needs to go up. I know there need my light handle. I know that I need my suction, my suction Bowie, my suction. I know that's all going up. I know that I have to count those, and this is going to go with my surgeon. That way I can go ahead and get my instruments. Like I said, we tend to not use back tables, but I'm going with it. Okay, notice this. A lot of people were getting hit because their towels weren't coming all the way down. Your instruments have to be on your towel. You can go ahead and set yourself up for success by going ahead and rolling your towel so that your roll towel is done prior to you putting your instruments down. Priscilla, can I get your help again? Or, well, RJ's right here. RJ, can I grab you? Here's my instrument count.
Miss J, Miss Art, we won't get marked off by not doing it. Miss J marked me off for not doing it in order, but that made sense to me. So I was wondering.
That particular section had to be done in order.
No, I know, but this right here,
Yes.
it's okay. That's what I'm saying for the.
On the sheet, you'll see.
Okay.
However the sheet says, that's how you do it. Same thing. Okay, instrument goes down. Now, you want to move with a purpose, right? For TNA, make sure you pull this out because this is just to clean out your suction. For TNA, you're going to think about what you need first. You need to retract. I'm looking on the board because my circulator wrote up. My patient's about 30 years old. All right. So I'm going to pull out my retractor and 2 blades. Now, it depends on if you're close to your doctor. If you know your doctor pretty well, you can load it. If you don't know your doctor, don't load it. Just put it up here, let them get the blades themselves. Once we've gotten the retractor in, they're going to need to be able to see what's going on. They need a mirror. Once we've gotten the mirror, they're going to want to retract some stuff, get it out of the way. So you need your herd retractor, which I don't see one in here. Miss B, can you do me a favor and open up the other set to see if they have a herd in there? It's supposed to be one, but I don't see it. I'm just going to keep moving, putting stuff up that I know I need.
I don't do TNA very often, so.
Thank you. So you have your herd. And it's in order. So we're going to retract. We're going to look. We're going to move out of the way. We're going to take out the tonsils. We're going to do the, this is actually going to go through the nose, come up to the soft palate, pull up the soft palate. We're going to plant this here. Then we're going to take corrects. Oh, it's right here.
Oh.
That's okay. I'll move that one back. We're going to take some corrects. Correct. Make sure you have a tonsil ball loaded. You guys have already done this, so we should not be having to show you how to reload a tonsil ball, right? You guys remember?
Yes.
Okay. And if you only have one Schnitt tonsil, then your Schnitt tonsil will have your tonsil ball. With me, remember, I keep these in, so please do not twist it. Okay? I keep them in. So I go to the other side and I pull them out. If you're with Miss Jimenez, she does. This is how you know your surgeons. This is a surgeon's preference. So this is really good that you guys get both ways. For me, I need that string loose. Okay? And you'll see when we're in there. So I only have one Schnitt tonsil, so I know that I'm going to pull up, keep the palate up with this. Okay? The other thing that you would have is a soap. Normally you use a Fred, but if you have a baby soap and water, we use that as a anti-fogger as well. What do I mean? This gets fogged up in the mouth, so the doctors will do that, or they'll use a Fred to keep it from fogging up. Okay? So you have that up as well. That is it. The only thing that you have to do, which we're not going to go over because you guys know how to do, is a count. We're only counting Ratex and 5 tonsil balls. That's all I have up. That's it. Some doctors do like to inject, but you'll know that because that's on where. Bam. Some doctors do like to suture, but you'll know that where. Yes.
How many protects?
How many come in a pack?
10.
5 or 10, sorry.
Okay.
5.
And then and these are 5. So do me a favor, if you do have this, keep them in here. Some just have them in the, you know, in this. The case goes super fast. So, I'm gonna ask for your stuff, alright.
Okay.
So, start just sitting down. Drapes come up. Okay, this goes down like normal, right? Half it goes down. Now for the turban, that's what. So for the turban, Miss B has done a lot of these turbans. With the turban, you will notice that I have 2 towels and a half sheet. I'm going to cuff my hand. If that person had hair, she would lift up the hair for me.
Yep. And I like to put it in a ponytail because it's easier to secure it in the hand. And then I took its head off.
So you watch, my hands are You're going to
Just put that back on.
and then, and then the doctor's gonna take and make a turban. Making sure to keep the nose free. And don't stick this in their eyeball. 'Cause I think that would be a sad day for them.
And honestly, that happens more than, not the eyeballs, but like, you're gonna use this for rhinoplasty, you're gonna use this for a lot of face cases, and if you attach it to their scalp, like, and leave penetration marks in their hairline or whatever, you're gonna make somebody really angry. So just always check your margins, like, stick your finger in there, make sure everything's good.
And we'll just go. Then as far as the case, it's kind of like I just told you. This goes in the mouth. And the reason why we tell you to be careful, because I want you to think about this. The only thing keeping this patient up is going to be this Mayo stand. So if you jerk on it, if you do anything crazy, the mouth is suspended like that. You guys get it? So if you're comfortable doing this, don't. Okay? So light handle same, that gets passed off the same, and then it's automatic. Boom, and then you go through. Okay? You guys have already done the TNA case worksheet, right? So you kind of know the steps. What we needed to show you is the actual setup. Okay? Huh? Go ahead. Did you have a question?
Nope.
What would you say?
I said, damn, I can't read my writing.
I can't help you with that one. Any questions? Concerns? All right, switch. Well, tell the other group to come.
Kayla, so would the cleanup be the same as well?
Yeah.
Breakdown?
Breakdown.
Mayo, back.
Yeah, so
well,
you
no
saw
back
some
table.
stuff I took things off. So the new sheet is specific for the TNA and DNC.
This is penetrating.
Yeah.
That's what you said, not to get it.
Yeah, and like I said, this part will be up. And what we'll do is we'll let the next group take, okay, or you can take pictures. Yeah, take pictures, take
Well,
pictures.
no, of the mayo, because I am
That's okay.
a disaster.
Every new job I get, I take pictures of whoever set up before me.
That's, I just
Yeah.
like to see the mayo stand.
I think it's great, yeah. As long as you don't drop your phone on it.
All right, so let me stop this
Yeah, I'm gonna
one.
put it in the future.
So now I'm gonna stop this one because then they'll have the setup and then you guys will get it.
No, that's her.